Hello, my name is Taylor Slaney. The date is October 25th, 2022, and this is my Unit 2 Case Connections assignment. So for my Case Connections assignment, I decided to look more into Case Study 2 and Case Study 3. So in this project, or in this presentation, we'll be meeting two patients that suffer from two different metabolic diseases that can have debilitating effects if not managed properly. In Case Study 2, we meet a 16-year-old female patient that has been recently diagnosed with a deficiency of glycogen phosphorylase. This disease that she has been recently diagnosed with makes it difficult for her muscles to utilize its stored energy, causing her to be tired and suffer from muscle fatigue, especially during exercise. Our second patient in Case Study 3 is a 5-year-old boy who has been a sickly child with low insulin levels at his baseline in 1 hour after a glucose load. With his symptoms and lab results, it can be assumed that this young patient has type 1 diabetes. In this paper, we will learn more about both of these diagnoses, the effects that they can have on our patients, symptom management, and how biochemistry is at work. So for Case Study 2, we have our 16-year-old patient who was recently diagnosed with a deficiency of muscle glycogen phosphorylase, most likely to be glycogen storage disease type 5, also known as GSD5 or McArdle's disease. GSD5 is the most common disorder of skeletal muscle carbohydrate metabolism and affects 1 in 100,000 individuals. The onset of symptoms typically begins in childhood, during the first 10 years of one's life. However, most individuals are not diagnosed until adolescence or their early adult years. Symptoms for these diseases include exercise intolerance, muscle pain and stiffness, fatigue, elevated levels of creatine kinase in the blood, and darker colored urine. If an individual with GSD5 participates in uninterrupted intense exercise, symptoms of the disease will increase. However, if the exercise is stopped or intensity is reduced, the symptoms will decrease. GSD5 is an autosomal recessive genetic disorder that is caused by a mutation in the PYGM gene that codes for the myophosphorylase enzyme that is located on the Q arm of the chromosome 11 in position 13. Myophosphorylase is an enzyme that is found in the muscle cells and is the enzyme that breaks down a complex sugar called glycogen into simple sugars called glucose 1-phosphatate, which the muscles use for energy. Although there is no cure for GSD5, there is symptom management and treatments that can help reduce symptoms. To help explain a complex medical diagnosis and ensure that my patient feels comfortable, I will answer her 4 questions using layman's terms, explaining this complex medical diagnosis in a way that my young 16-year-old patient and her family can understand will hopefully make my patient feel empowered and informed about her new diagnosis. So on this slide, you can see that we just talked briefly about what GSD5 is, how common it is. It is actually a very rare disorder. Some of the symptoms that we mentioned was the exercise intolerance, muscle pain and stiffness, fatigue, and then elevated creatine kinase levels, and darker colored urine, which we will go into further. So now we're going to answer my patient's 4 questions that she has for me. But I do have this little visual picture, breaks it down very simply as to what is exactly going on. As you can see, with a healthy individual, you have the PYGM gene that is unaffected, which will then be able to properly make the myophosphorylase enzyme that is needed for glycogen breakdown. And then you see with somebody who has McArdle's disease, also known as the GSD5, where the PYGM gene has been affected and no longer functions properly. So answering our 16-year-old patient's question. So her first question is, I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? So I respond by saying, normally during exercise, an enzyme, which is a substance that helps speed up a chemical reaction called myophosphorylase, breaks down glycogen that has been stored in the muscles into simple sugar called glucose 1-phosphatate that the muscles can use for energy. With glycogen storage disease type 5 or GSD5, there's a mutation or change in the gene that changes the enzyme phosphorylase that breaks down glycogen. Because a person with GSD5 does not create myophosphorylase, the body will not be able to break down glycogen into a simple sugar the muscles can use for energy. My patient's second question is, I really like to take long walks. Will I be able to do this with my friends? I responded by saying, as her healthcare professional, it is important for your overall health that you are still staying active, and walks with friends and family is a great way to do that. I would encourage you to share your new diagnosis with your family and friends so that they are aware of your diagnosis and possible limitations. If while you are walking you start to feel pain or stiffness or become fatigued, I would highly recommend either slowing down or even finding a bench or a nice place to sit. Excessive exercise, such as a long, fast-paced walk or run, can cause severe muscle pain and muscle cramps, which can result in muscle breakdown and damage. This is a very important part that I want to stress to my patient as well, that this damaged muscle can secrete a toxin called myoglobin into the bloodstream that can damage your kidneys, and that's where that darker urine comes into play. So definitely educating my patient on, if she ever does see darker urine, that's a really good sign that she needs to slow down whatever exercise she's doing. It is important to listen to your body and take things slow when you need to if you are having pain during any exercise, such as a walk. Once that pain has subsided, it is safe to continue the exercise again. My patient's third question is, as a result of this deficiency, will I need to get up at night to eat to maintain my blood glucose levels? I responded by saying, this disease has less of an effect on your blood glucose levels and more of an effect on your body's ability to utilize the glucose it has stored in its muscles. While at rest, the muscles in your body will not be needing high levels of sugar. However, during the day, to alleviate symptoms of exercise intolerance, I would recommend eating a well-balanced diet throughout the day to ensure that there is sufficient blood glucose available to your body. A well-balanced diet for someone like yourself with GSDV consists of eating a diet with about 65% complex carbohydrates. This would include foods such as vegetables, fruits, cereals, pastas, rice. Another strategy is to eat a simple sugar 20 to 30 minutes prior to an exercise, and this could be something as simple as a carton of juice or even a candy bar. And then finally, my patient's last question is, do I need to worry about producing excessive lactic during intense anaerobic exercise? And I responded by lactic production should not be a concern for you with your new diagnosis. Traditionally, diagnosis of GSD5 was based on a patient's inability to produce lactic during a forearm exercise test. So I just ended my case study for this patient, case study 2, by saying GSD5 is a rare disorder that can have negative effects on an individual's life. However, with adequate patient education, a balanced diet, and light exercise routine, good symptom management is possible and a patient can live a relatively normal life. So for case study 2, we meet our 5-year-old young pediatric patient with his unusually low insulin levels. So in case study 3, a 5-year-old boy was brought into the pediatric clinic by his mother for his annual exam. His mother reports that he's been a sickly child and often appears lethargic. During the exam, our patient's mother also mentions that her son appears to be excessively thirsty and frequently urinates. Given his symptoms and the clinical presentation, blood samples are taken with the underlying suspicion of type 1 diabetes. Blood test results show low levels of insulin both at baseline and 1 hour after a glucose load. Blood tests also, insulin is a hormone produced in the pancreas that regulates glucose in the blood by bringing glucose into the cells so that the glucose can be used for energy. Someone with type 1 diabetes produces little to no insulin, and therefore their bodies are unable to use the glucose that is in their blood. Type 1 diabetes is a chronic condition that has no cure, so treatment is focused on symptom management by regulating diets, frequent glucose checks, and insulin injections throughout the day. So on this slide as well, we just talked about what are some of the symptoms. Is there a cure? Which we answered no, there's not, but there is treatment options. And then we talked about how this new diagnosis can be managed. These were the lab levels that were obtained from my patient. As you can see, he has very low insulin levels at both his baseline and then 1 hour after a glucose load. Here are some of the symptoms. Much like his mother mentioned, we have the frequent urination, excessive thirst, fatigue. I have this little picture that shows checking your sugars, how important that is when your sugars are low to be eating or drinking something with sugar, and if they're high, giving yourself some insulin. And then here we talked about diabetes management. And then here were the 3 questions that the mother of this young patient asked. So because this young patient, the first question is, what is the information likely to suggest about the underlying biochemical basis for the patient's symptoms? I said because this young patient produces little to no insulin, he will be unable to transport glucose that is in the blood to cells. Glucose that is in the blood and not being transported in cells is essentially useless to the body and cannot be utilized for energy. Second question is, what would you predict the patient's fasted blood glucose levels to be given the current condition? Above normal range, within normal range, below normal range. I responded by saying, the patient will have extremely high levels of glucose immediately post-fed state due to his inability to move glucose intracellularly. However, because glucose will not be transported into the cells to be used for energy and storage, during a fasting state, this young patient will have very low levels of glucose because there will be no storage to draw from during a fasting state. And then finally, based on this diagnosis, what 2 regulatory enzymes are likely to be active in this individual's current condition? Be sure to include rationale as to why the activity of these enzymes will increase. And I said the 2 regulatory enzymes that would increase in this patient's current state with unmanaged diabetes would be phosphofructokinase and pyruvate kinase. With unmanaged type 1 diabetes, this patient will have low levels of insulin, meaning unutilized glucose in the blood that is not being transported into the cells for energy. These 2 regulatory enzymes would be elevated because as a type 1 diabetic, this patient has a difficult time using glucose to produce energy in the blood, so increased levels of phosphofructose kinase and pyruvate kinase will help regulate ATP levels in the cells when there is no glucose to use. So finally, type 1 diabetes can be a devastating diagnosis for a family. However, with early diagnosis and good symptom management with frequent blood sugar checks and insulin injections, patients can go on to live a very healthy, normal life. There's new technology every day being created for type 1 diabetics to make their symptom management easier. So these are the references for my project, and thank you so much for listening. I hope you have a wonderful day.